this morning. We're actually moving into the afternoon at this stage. So I'm Paula Cogan, for those who I haven't got to meet, CEO of Cognate Health. So we have a packed agenda. We were just discussing it there this morning, and hope at the end that you'll have a little bit more clarity as to what the latest recommendations are and the impact that this will have on you and your employees as we all grapple with the rising case numbers. So I'm delighted to welcome our panel this morning, Jennifer Cashman, our good friend and employment lead at RDJ. Can I take the opportunity to congratulate Jennifer, who you've been recognised as the thought leader for 2021 in employment and law by Mondiac. So really well done and congratulations.
Thanks a million.
We are also joined by Dr. Nuala O'Connor. Dr. O'Connor is the ICGP's clinical lead on COVID-19, while also managing her really busy day practice where she is sitting at the moment. Great to have you with us as well, Nuala.
Thanks for having me.
And finally, our own Professor John Gallagher, CMO, who doesn't require any introduction. So I'd like to take the opportunity to bring you up to speed on all things Cognate. We have in October moved to our brand new clinical space and offices at Bury Manor Road. It's a very exciting time for the company as we can now expand and deliver several new services in OH, including executive medicals and indeed aviation medicals in 2022. We will also launch our new website next week. It is a lot more user-friendly and will allow us to interact with you more efficiently and provide you with up-to-date details on our new services. Finally, can I suggest you follow Cognate Health and Jennifer on LinkedIn for the latest updates, as we know the guidance is evolving on an hourly basis at the moment. So some housekeeping. We will ask that you mute your sound, and we will be recording the session and we'll share it with you later. Please feel free to add questions to the chat box. And if we do not get to them all this morning, don't worry, we will contact you again directly. So over to you now, John.
Thanks, Paula. Yeah, packed agenda. Thanks very much indeed. Let's go straight into it because Nuala is going to do a more formal presentation with some slides just to set the scene in terms of what COVID looks like at the moment. That'll take 15 minutes or so, and then myself and Jennifer will have a to and fro with regards to current topics. So we have a lot to get through. I expect we're talking about 3/4 of an hour thereabouts. We hope to be done by 1 o'clock, if at all possible. And we are recording this as Paula has said. So let's get straight into it. Nuala, will you set the scene, bring us right up to speed with regards to where are we with COVID? Friday lunch hour, the 12th of November.
Absolutely. Charlotte, do you want to launch the slides there, please?
Yes, sorry, no, 2 seconds.
Yeah, you're grand. Yeah, no problem. So I think I'm the one here that's been brought here to scare you all into doing what we all should be doing to get this disease back under control. So I'll just wait there for Charlotte to get going. You having any difficulty, Charlotte? Do you want me to see if I can launch them myself?
Can you see those slides?
Nope.
No.
Oh, there we are. Yeah. So if you go into a slideshow mode, play slideshow there maybe, and get up into the full. Okay, great. So let's just move on straight to the first slide, please. So what I'm going to try to cover really is about staying safe this winter and particularly in the run up to Christmas. So I'm going to do a little on the current picture in Ireland and Europe, why it's just not about COVID anymore and the surge in winter viruses, and what actions we all need to take to get back in control of COVID, and why more than ever we need Team Ireland to combat COVID-19. Next slide, please, Charlotte. So this is an image, we call it an epidemic curve. So what this is doing is it's showing you the waves of the virus that we've had so far. So we all know we're in a fourth wave. So if you go to the bottom left-hand side of the screen, that takes you back actually to the week of the 3rd of March, the first week of March in 2020. And in actual fact, the first case of COVID was on the 5th of March 2020. That's where it was transmitted in the country. And at that stage, there was only 6 other cases which had come imported. And remember at that time, you know, we had the strange Paddy's Day, everything was shut down, no pubs, no churches on Paddy's Day, and we were all terrified. We were all terrified about this whole thing. And you can see there, if you look at the size of the wave that we had then compared to even where we are now, which is on the right-hand side, I think part of the problem at the moment is that nobody's terrified anymore. So as you know, during 2020, we were all shut down. We were, you know, 5-kilometer radius. We couldn't go to no pubs, no restaurants, nothing like that. And then as we gradually started to open up a little, and the cases started to go up again. And then we all know in the run up to Christmas last year, the travel came back and people going. And at that stage, we had no protection from vaccination. In fact, the first doses were given on the 29th of December in 2020. And because of all the increased socialization, but also the emergence of the Delta variant, which was much more transmissible, we ended up with this massive spike in January of this year with 6,000 cases per day. We gradually got that under control with restrictions and people cooperating with those. And the vaccination started, and we started to get protection from vaccination quite early on. But it actually took us until the 9th of September to get 90% of our 18 plus vaccinated. And just this week now, we're up to just over 90% of our 12 plus vaccinated. And despite that, we still have an awful lot of cases. And I'm going to go through this as to why that might be. So if you look at the box at the top on the right-hand side, that just shows you the amount of cases we've had so far, for over 484,000 and 5,500 deaths. But the next box down is actually the case numbers over the last number of days. So we're not up to the highs of the 6,000 that we had in January, but we are, you know, averaging over 3,000 cases per day at the moment. Next slide, please. So often when I'm talking, people want to know what's it like in my county, what's it like in my area. So I like simple things. I like colors rather than figures here. So dark blue is very bad, and medium blue is a little bit less bad, and light blue is a little bit less again. But in actual fact, there's COVID everywhere. And the orange on the right-hand side, that shows that in the last 7 days, the amount of COVID in every single county in this country is increasing and not decreasing. So there is no county that's actually safe. Next slide, please. And indeed, all over Europe, Europe is in the grip of a 4th wave at the moment. This is accelerating rapidly, and most especially in countries where there's poor vaccine uptake. So if you look at here we're looking at the 14-day incidence rates per 100,000 of population. But if you look at the countries to the top, Slovenia, Estonia, Latvia, Croatia, Lithuania, Slovakia, Eastern European countries, a lot of Eastern European countries, they have vaccine hesitancy. There's a distrust towards the government. There's been issues with vaccine programs in the past. And so they tend to have lower vaccination rates. The odd one inside there is Austria, but in actual fact, that's made the headlines recently. Austria has really, really high rates again at the moment and is looking at going back into lockdown measures because, again, they have poor vaccination uptake. Next slide, please. And it's not just the COVID rates. We know here that in hospital we have over 500 people in hospital, 93 people in intensive care, and this is right around Europe. Everywhere the hospitals are more people are being admitted to hospital, more people to intensive care, and more people are dying. Next slide, please. So how can it be that when Ireland has the highest rates of COVID vaccination in Europe, that we still have this amount of disease? Okay. And I think there's been a lot of, this is a kind of something people are finding a little bit hard to grasp, but we have a population of just over 5 million in Ireland, and about 820,000 of those are under 12. So they're not eligible for COVID-19. And then there's probably another maybe 150,000, maybe a bit more than that, who don't wish to get vaccinated, have chosen not to get vaccinated. So we have over 1 million people in this country who have no protection against COVID-19. So herd immunity was never possible. And the other thing is that we must remember that even though we're in Ireland, we could do zero COVID strategy like they tried in New Zealand and Australia, and people can't stay shut forever because there are two countries on this island, and we have a border where people live and work across either side of the border, and we have government strategies towards COVID that were quite different between the two jurisdictions. Also, the current vaccines that we have, and they're really, really good vaccines, but they're not perfect. To be able to get herd immunity, we would need to have over 95% of the population vaccinated with a vaccine that was over 95% effective. And we all know that the current vaccine effectiveness is waning, but vaccination was never our only weapon against this disease. Next slide, please. So the benefits of getting vaccinated. So vaccination, it reduces, but it doesn't eliminate the risk of transmitting the virus. So if you get COVID-19, even if you're fully vaccinated and you've no symptoms, you can still pass it on. And being fully vaccinated, though, it means you tend to get a much milder illness and you recover much faster. And the majority of people who end up in intensive care are unvaccinated. And the majority of people who are vaccinated and who end up in intensive care tend to be older and have underlying medical conditions. But that's not always the case. We also get younger people, completely fit and healthy, ending up really, really ill, because this is a peculiar disease and we don't quite fully understand it yet. But what we do know is that unvaccinated people have no protection and they cannot rely on getting protection from herd immunity. So that is a myth that has been, there's something that's been put out in the media about that, and it's important to debunk that myth. Next slide, please. So who's getting sick and who's ending up in hospital? So at the moment, most of the cases are in people under 65. And I've already said that most of those will get a mild illness and recover by themselves at home. Most of the hospitalizations are actually occurring in the over 65. And we're already seeing evidence that the booster vaccinations in the 80 and 75 plus, the cases are falling in those age groups. So we'll be moving on down through the age groups down to 60 now at this stage. But the healthcare system is significantly stressed, not just from COVID, it's also by the winter viruses that are circulating at the moment. And the next slide, please. So winter viruses. So I work in general practice and I'm seeing people, sick kids, sick adults every day here. And the vast majority of them with the coughs, colds, sore throats, earache, sinus symptoms, they don't have COVID. They have all the normal winter viruses. So the RSV, the other coronaviruses that cause the common cold virus, rhinoviruses, a whole host of things. And they all spread in the same way. These are all respiratory pathogens. And there's only two ways you can get them. One is if somebody coughs in your face and you don't have a mask or anything on and it gets into your eyes, nose and mouth. Or the second thing is if you get fresh virus on these, because you're touching things, not washing your hands like before you have the food, touching door handles, and you're putting your hands up to your face. And all of the things that we've been doing to stop the spread of COVID, they will stop the winter viruses. But it's the winter viruses that are also causing pressure on our hospitals and emergency departments. Our pediatric wards are full with kids with bad bronchiolitis from RSV, not from COVID, and they were empty this time last year. So the absolute key message for everyone in this country is that if you have symptoms of an infection, you must stay at home until you get better. A negative antigen test does not mean you've got the green card to go to that party or go to some social event or go to work, okay? And if you have symptoms, you should be getting a PCR test. And even if your PCR test is negative, you still have to stay at home until you recover, because otherwise you're spreading the other infection in your workplace or at that social event that you go to. Next slide, please. So what actions can we take? So if you're not already protected against COVID-19, it's not too late to get your primary course. If you're eligible for a booster vaccination, please go forward for that. You need to be 6 months, at least 5 months since your last vaccine. And if you've had COVID-19 since you had your vaccines, you have to wait until 6 months after your positive test results before you can get a booster dose. All of the details are on the HSE website. Next slide, please. So get protected before the flu season. Now is the time. If you're over 65, medical conditions, and it's free, a nasal spray for all children, a pneumonia vaccine if you're over 65 as well. Next slide, please. Vaccination alone is not going to get these numbers under control. We need to use all the other public health measures to flatten the curve. And the next slide, I think, is my final slide. So how are we going to stay safe? Get vaccinated, stay at home if you have symptoms of a viral respiratory infection, halve the number of social contacts that you have over the next few weeks. That's the only way we're going to get in control of this virus, and avoid in particularly the crowded, poorly ventilated indoor spaces, along with all the things we all know, the mask wearing, the hand hygiene, cleaning frequently, touch surfaces. But if you have symptoms, an antigen test is not good enough, you need the PCR test. And just on my final slide, just thank you for inviting me. And I'd just like to acknowledge all of my colleagues within the HSE, public health and everything. You know, it's been an amazing journey through COVID. And if only we could harness the can-do mentality and effective working partnerships that we've used to come together to combat COVID-19, I think we could truly create the health service that our population deserves. Thank you.
That's excellent, Nuala, as ever. Thank you. I'm envious of your presentation skills. Always on top of things. So a couple of things before I just move on, Nuala. The piece about people coming to work while symptomatic. Do you think that's a big issue in terms of, I suppose you mentioned the antigen testing. What we're certainly seeing is people who are waking up with symptoms doing an antigen test and then going off to work and maybe doing it again the next day, and it's negative, they go off to work, and the third day they do it, of course, it's positive. Now they go for a positive PCR, and you have 2 days of contacts going on that you got to go back on.
Absolutely.
Do you think that's an issue? Yeah.
Yeah, I think it's a big issue, and I see it actually. People are using, they're doing antigen tests on kids, and they're negative. They're sending them into school, and I think it's the whole thing is it's broader than COVID, and it's if you have symptoms, the PCR test is the gold standard. But even if your PCR test is negative, you still have an infection, and you're spreading that infection in the workplace. And I mean, last year it was amazing. We hardly saw any kids that were sick. Right, and more adults, and that's because we were all doing what I've been telling people to do for years: is stay at home if you've got symptoms. Yeah, you know,
that's a big message, isn't it? Yeah, that they stay at home if you've got symptoms, because I think people are getting mixed up. They're buying antigen tests and they're using them as a sort of, well, I can go out if this is negative despite my symptoms. And I think that's a message that we need to get out, which is that if you have symptoms, stay at home and probably get a PCR test. Just before we finish with you, in terms of where we see this going, and we were talking about this beforehand, just before we went live. My feeling is that we're coming to the latter stages of this version of the pandemic, as in this version with Delta virus, and there doesn't seem to be anything else on the horizon at the moment. And then hopefully we will move into a sort of endemic phase.
Yeah.
And of course, the controls that apply may well be different for both of them. How do you see this panning out over the next 12 months?
I think if anyone thinks they can truly predict how it'll pan out over the 12 months, then, you know, I would believe them, because you know what, this is the virus that keeps on giving. It's amazing how things have changed. And I think what we need to focus on is what we know now and what we can do now. And at the moment, what I see is the biggest problem is the increased socialization and going out if you have symptoms. And I think to enable us to get back in control of the numbers at the moment, that the key message is that we all need to just take a little step back. Do I really need to go to that meeting? Do I need to socialize with those people? Tend to socialize in smaller groups with people that you know, and just take a step back and risk assess.
I think that's right. But I think this has all the features of something that will become endemic in due course, you know, with and probably the need for further vaccination, and to just join the other 4 coronaviruses that are part of the circulating coronavirus population. Yeah.
And hopefully the biggest concern is that we could end up with a worse variant.
Yeah.
But at the moment, thankfully, actually, Delta is still really, really dominant worldwide. And so our current vaccines, particularly with boosters, will give us a pretty good protection, and certainly excellent protection against severe disease, hospitalization, and death.
Yeah, it's the perfect virus. I mean, it's very, very, very infectious, but it doesn't kill people. That is the perfect virus, and that's why it'll probably keep on circulating, because we're just going to have pockets of people who are not immune, etc., etc., etc. Listen, Nuala, that was great. Thanks very much indeed. You're going to stay around?
I'll stay around for a little while and
Wonderful.
and listen to the next bits.
I'm going to move over to Jennifer now. Neither Jennifer nor I prepared any slides. We decided we'd keep slides away because we wanted to bring it right up to date. And I'm glad we did, because last night there was a bit of shift in thinking. I suppose, Jennifer, I'll just come straight across to you in terms of this and the return to work protocol. And I follow you on LinkedIn, and I must say, I'm always interested to see what you're writing for RDJ. Great blogs, lots of information, and an influencer indeed, as Paula said early on. And you did a very good return to work protocol blog recently for Rome Day German. I'm just wondering, could you just give us the main highlights of it? And I guess just be mindful of the fact, what are you thinking about when you're hearing about the work from home coming back on the agenda again?
Yeah, thanks, John. Hi, everyone. Yeah, lots of activity over the last 24 hours in terms of where we're at. And I suppose, the overarching point in all of this, John, that you and I were discussing before we went live, is that, the work from home guidance has been there and has remained there. So that's nothing new. Because I suppose back in August, we had the Taoiseach's announcement about moving on to personal responsibility and reframing the challenge. And obviously at that stage, it was hoped that from the 20th of September, we'd have this phased and staggered return to the workplace, and that as in from the 22nd of October, that we possibly would be contemplating a full return to the workplace. But obviously that was all turned on its head as things deteriorated in terms of what Nuala was talking about in case numbers. So in effect, the guidance has remained that people should work from home where it's possible to do so, but that this phased and staggered return to the office could commence as in from the 20th of September for what the government described as specific business purposes. Now, the difficulty, of course, for employers is that there is no definition of what specific business purposes are, and therefore it is left up to each individual employer to determine what those specific business purposes are in each specific. And there was some general talk by the government about maybe bringing people in for training purposes, bringing people in maybe who'd been hired during the pandemic who'd never seen their workplace, bringing those people in maybe to meet team members or whatever. But there was nothing set in stone in terms of what those specific business purposes are. So that's where we've remained. And we had an update to the protocol in September following that August announcement. And then we had a further update to the protocol after the 19th of October announcement, where we were told the brakes were being put on. And in fact, all of the public health measures would not be removed, and they would remain in place. And that a full return to the office wasn't contemplated now until spring 2022. So for lots of employers, that simply pushed out. For lots of employers that might have been planning a sort of a fuller return to the workplace in October, November, they simply just put the brakes on that and pushed that out to spring. And a lot of employers who I'm talking to are saying it'll be February, March before they contemplate that. Some employers are bringing people in maybe one day a week in the meantime, just for those specific business purposes, whatever they may be. And in terms of, I suppose, the work safely protocol, the important thing to say about the work safely protocol is that really it's the Bible for employers in terms of having people in the workplace, because it's applicable to all sectors. So it's applicable to every single employer in every single sector. And it is the minimum set of requirements in the workplace. So that's the minimum you need to be doing, and anything you do in excess of that is at your own discretion and in conjunction with your occupational advisors and your health and safety advisors. But your work safety protocol is the minimum, and the work safety protocol talks about all the things that Nuala has been talking about: wearing masks, hand sanitization, social distancing, and of course the social distancing means that for most employers that puts a very reduced capacity in terms of the workplace. You hear employers talking about, we're at a 40% capacity. We're at, and most employers that I'm talking to, even those who are bringing people back on this phased and staggered basis, have said, look, we're at a 40% capacity and it's not mandatory to come in. So you can come in if you would like to come in on maybe certain days or certain times of the week, but it's not mandatory. So a lot of employers have continued to operate like that. But I suppose the important thing, as I say, to keep hammering home is that this really is a health and safety issue and an occupational health issue.
Yeah.
And so it's Cognate and your health and safety advisors that you need to be liaising with, using the work safety protocol as your basic set of requirements. And I had it throws up lots of interesting queries. So I had an interesting query during the week from a client who said, you obviously in the hospitality sector have to show your vaccination cert before you can dine indoors. What about canteens? So, I as an employer can't ask about vaccinations for my employees, but what about employees who are using the canteens? And the answer is, canteens are part of the workplace, so the same rules apply. You can't ask it in terms of vaccination status. But there's lots in the work safety protocol about canteens and how to operate them properly, and actually shutting them down if you don't feel that you can operate them safely and in line with all of the requirements set out in the work safety protocol.
So is the advice there that you can't ask for a vaccine? Because typically. And I was getting a coffee yesterday in a place, and the person in front was asked, "Are you staying for your coffee?" And they could well have been a staff member. They stayed for coffee, and they said yes. And they said, "Well, I need to see your vaccine cert." So, I mean, is for companies with large canteens, is this something that
it's different
they should be doing?
No, it's a different. The canteen isn't considered the part of the hospitality sector that are subject to the COVID certs. Now, I know there is talk as of last night of NPHET recommending that the use of COVID certs should be a broader should be a broader requirement than it is at the moment, so that there should be a broader ask for vaccination certs. So who's to say that we won't see that broadened out? I know the cabinet are meeting next Tuesday to discuss the latest advice from NPHET. So who's to say we won't see that broadened out in terms of requirements?
How about that lead worker representative? That seems to be pretty. It seems to be pretty prominent in terms of the advice. Are most employers engaging with that, do you think?
They are. I mean, most employers, John, in my experience, have their COVID response teams and they have their lead worker representative or representatives for bigger organizations sitting on that. And I think the really important thing there is that, they are effectively the conduit, I suppose, between management and the employee population. So if you're in a very big organization, it really is important that you have lead worker representatives that actually are representative of each of the different levels in the organization, so that people really feel that they have a voice and that they have that they can bring their concerns, and people do bring their concerns to the lead worker representatives. We're certainly seeing that in organizations where the COVID response teams are meeting and they're feeding back into the response team, and it really is important. It really is important that lead worker representative is followed in workplaces, and that people are appointed, and that people are given the freedom as those representatives to make sure that they are allowed to go around and take people to task if they're not following the requirements of the workplace. And people forget, to be fair to people, they forget when they stand up from their desk to put on their mask or whatever. And sometimes it's just that they need to be reminded to follow the basic requirements.
Good questions for you later on, but and they'll include what to do. For example, if somebody comes to work and refuses to wear a face mask, or if somebody's refusing to wear or to work with somebody who said to them that they're unvaccinated, those sort of questions. We might come back to those, because I think just in terms of what we see, that issue, and especially since last night, I guess, I think there's been a bit of a step back in terms of our progress with this one. I mean, we never really got to October the 22nd. And if anything, we're sort of between September and October until February. And I'd be saying to employers at the moment, look, the advice still is that if you can have people working from home, it's good to work from home. That question of meetings has come up, Jennifer. And of course, meetings / Christmas parties, you could chuck in there as well, but congregated settings held on behalf of the employer. I'll ask you your thoughts on that in a second, but I guess one thing that and we're asked quite a bit about, can we have meetings? How many can we have? I think, and I'd be interested to see if you agree, that people have got to really think, do I have to have a meeting at all, as the first question? And then secondly, is there a reason why we shouldn't be doing this using telecommunications, or Zoom or Teams or anything else? And only if all those are, only if it's imperative would you have a meeting. But I mean, there's so many things that you have to put in place just to have a safe meeting. You've got to have the biggest room, the smallest number of people, the minimum amount of time, maximum ventilation. You've got to have pre-preparation in terms of advising people about symptoms, when not to come. You've got to keep a log of everybody inside there. You've got to have the cleaning material. I mean, there's so much that you've got to put in place just to have what can really be only a short meeting. That my advice at the moment is really, I mean, do you have to meet? At the moment, I'd be saying postpone most things until February. What are your thoughts on that?
100% agree, John. And again, if you go to the work safely protocol, it talks about the fact that meetings should be remote where possible. And we've shown over the last 12 months that it is possible to do quite a lot of things remotely. And yes, people are getting sick of it. But that's not a good enough reason to abandon it, especially now when we have the numbers as they are. So 100%. I mean, there's very little that can't be done. That can't be done other than face to face. I mean, there may be documents that need to be signed or whatever. But again, you've got to look at all of the ventilation, the masks, the hand sanitization, as you say, the forms. There's quite a lot from an employer's perspective in facilitating meetings, or forcing people to have meetings, or allowing meetings to take place, or however it's panning out in the workplace. There's quite a lot then behind that from an employer's perspective in terms of health and safety and all of the measures that they must put in place. So really, it's far more straightforward for everybody if we can do them remotely for the time being until we get out of this current wave.
I think that's right. I think there's just so much around that. All you want is somebody to report themselves being a case the next day, and you're potentially in difficulty with a lot of your staff who've attended that meeting. So I think remote is going to be best, isn't it, in terms of that?
Absolutely, yeah.
With
absolutely.
regards to the other thing about remote meetings, of course, is that it's more inclusive. I mean, if you've got a hybrid workforce, you've got people at home who you want to keep included in that. One thing we get asked, Jennifer, is about the workplace and ventilation. The day's getting cold. If we have all the screens and masks and everything else, do we need to have do we need the windows open as well? And the simple explanation, of course, is that you do, because they're two different things. One of them, the masks and the barriers are all about stopping the droplets predominantly from hitting you in the face or on a surface. But the ventilation is key in terms of reducing the amount of COVID that's present in the air in the room. So even cracking open a window is so important. The other thing that we see, I guess, is what about the people who can't return to work? And this is all around that return to work piece that you mentioned. I think at the moment, really, it'd be difficult if somebody is, and I'll ask you this, what about if somebody refuses to come back to the work? If the employer deems that it's essential, I need the person back in the workplace, but the person is refusing to do so, what would you advise the employer to do in that situation?
Well, the first thing the employer needs to do is to actually ask themselves, do I really need, can I stand over objectively the fact that this person has to come back into the workplace? So, and the answer to that may very well be yes, for whatever circumstances pertain. And if that is the case, and then somebody says no, then we have to examine why are they saying no. And you had Leo Varadkar coming out on the 1st of September after the government announcement at the end, after Micheál Martin's announcement at the end of August. I think somebody may have had a word in Leo's ear in terms of just hammering home the point that, feeling uncomfortable isn't good enough on an employee's part. And if they have, a contractual obligation to attend to the workplace, then they must honour their contractual obligation. Now, of course, in terms of the expectation at that stage was that, people would be moving towards a return to the workplace in October, which, as we're discussing, hasn't been the case. So the first thing an employer must do is examine objectively if they need that person back. Why do they need the person back, and to be able to stand over that. If the person says, no, I'm not coming back, we need to examine why. Is it just I'm uncomfortable? In which case we need to sit down with them and we need to remotely or otherwise, and we need to talk to them about all the measures we have in place in the workplace, and we need to sort of justify the fact that the workplace is a safe place, and all of the measures that we've implemented as we are required to do under the work safety protocol and our risk assessment from a health and safety perspective, and that we're satisfied that we've introduced all of the measures, and that the workplace is as safe as we can practically make it. And then if the person is putting forward a medical reason as to why they can't, well, then that's where we start talking to you in terms from an occupational medical perspective, and in terms of whether or not that is the case, and whether or not there's anything we can do to facilitate their attendance at the workplace if it's absolutely imperative that they are there. So I think they're the steps really.
They're the ones, aren't they? And I think it's, during August, September, as people were gearing up to getting people back into the workplace, we were doing a lot of assessments, even on those people who are cocooning and in the very highly vulnerable group. And really, employers were becoming prepared to get people back into the workplace, and people were getting their mindset that I'd be going back to work. But I actually think there's a bit of a stop on a lot of that right now, and certainly with the change in the narrative that's coming from NPHET. I do think that it's work from home is going to be very much on the agenda. It's unlikely to become mandatory, I'd have thought, but it means that I'd have thought, look, if you can keep it going working from home until February or so, that's certainly the way to go about it, isn't it?
Absolutely.
We're seeing people who, of course, the cocooners, we're still seeing quite a lot of assessments of people who cannot come back to the workplace because of their health problems. And we're doing those assessments in terms of assessing their risk, and certainly the very high risk people, it's just very difficult to recommend at this stage in time that they go back into the workplace. I think if they've been cocooning since start of last year, it's probably going to be that way for the moment. We'll come back to the pregnancy issue in a moment as well, because that's one we'll get to discuss. We're seeing a bit of post-COVID in people. And it's about 10% at 6 months, and it's still about 10% at a year by the look of things. It is a thorny issue that's going to be with us for the next 5 years or more, I reckon, and dealing with a lot of the mental health issues that are arising from that, and indeed from hybrid working. So a bit about hybrid working, Jennifer, and in preparing for the hybrid workforce. I guess a lot of employers are used to this now. There's for and against it. We know that. For it is that you can have a very happy, productive workforce in a hybrid situation. Against it, of course, that for people who don't want to do hybrid, it can be a challenge, and particularly a mental health challenge. So it's about, I think, for me, it's about engaging with people and making sure that this is their ambition. And if you can make it work for people, it really can work for both the individual and for the employer. What are you seeing in terms of hybrid working? What are the main, if I say it's the top 3 to 5 issues for employers that you'd like to say, look, you need to have this done, or you need to plan to do this very quickly?
Well, I think, John, you're right. I mean, I think the first step really is consultation with staff to find out what people want. There's an awful lot of assumptions being made about what people actually want going forward. And I suppose the longer this has gone on, employees' own views about remote working and all that it brings have changed. So I think there really is sort of ongoing consultation and communication with staff required in terms of figuring out what do people want. Now that's not to say that just because you're asking them what they want, you can give them what they want. Of course not. But it is interesting to take the temperature and see where people are sitting, because some people who loved working from home at the beginning of all of this are now, sick of it and are dying to get back into their workplace. So I think consultation is the first step for employers. Then the second step is using that information, deciding on what you can actually facilitate. So there will be roles in the workplace that you can't facilitate, hybrid arrangement. They will be roles, for example, take a receptionist role. And the argument will be made, well, we were doing it at home, when we were forced to stay at home by the government, but that's different because you didn't have visitors to the workplace. You didn't have, you didn't have all of the usual things that are going on in a workplace. So you may decide, for example, I'm just taking that role as an example, that role is not something that you can facilitate to work remote, and that role is a role that requires to be there. And I think you need to carve out and set those expectations from the get-go, that there are certain roles in this organization that we cannot facilitate any level of remote working, and they are roles that are required to be carried out from the workplace on a 5-day week or other basis. So your consultation, your decision in terms of scoping out your roles, what roles are suitable for hybrid working, what roles aren't suitable for hybrid working. Then you're looking at developing some form of a policy around that. My own advice to employers for the last number of months hasn't changed. I think it should be on a trial basis. I don't think anybody should be making any permanent decisions about the future at the moment, because we are in such a state of flux, and you'll see it in people. People are exhausted. People are exhausted from the roller coaster that is COVID, and they're exhausted from a lot of people are exhausted from home working, because expectations have gone up around productivity and home working. So I think I'm not so sure that employers should be making sort of permanent decisions. The other thing we're waiting for is there is legislation due on the right to request remote working, and we don't know what that's going to look like. So, any policy that an employer implements is likely going to have to be amended to take account of anything that the legislation sets out. Then you're looking at your health and safety approach. I mean, I've had so many conversations with employers where they've said, "What? I have to have a health and safety ergonomic assessments for people working from home, and I have to provide equipment for people working from home, but that's a double cost."
Yeah.
Yes, it is a double cost. That's the fact of the matter.
Yeah.
But under the health and safety legislation, as an employer, you have an obligation to provide your employees with the equipment they need to do their job. So if they need a chair to do their job from home, and they need a monitor to do their job from home, then you have to provide that to them. And the fact that, I've heard a lot of employers say, "Oh, but they've asked me to work from home." So, it's different because they've requested it, but you're facilitating it as the employer. If you're introducing a policy around this, then obviously you need all of the pillars of that policy around it. And ergonomic assessments, I know, talking to my colleagues in the litigation department, they've said to me, there's been a lot of remote ergonomic assessments carried out in the course of the last 12 to 18 months, because that's what we've had to do, because we haven't been able to do anything else. But going forward, where we get into a situation where it's no longer, it's safe again to do on-site ergonomic assessments, that's going to be the expectation, that somebody's ergonomic setup at home will be looked at more so than just across the screen.
It's a bit more challenging ensuring the safe workplace, isn't it, in the home environment?
100%, yeah. And employers are a bit horrified when you set out the requirements, but it really is important for employers to understand that if you're offering a hybrid model going forward, then you need to make sure that you understand exactly all that brings from a health and safety perspective, and the obligations that are on you from a health and safety perspective.
Because they're exactly the same obligations whether you're at home or in the workplace. And
absolutely,
I think this is certainly something that crosses in, I guess, into the mental health arena. Jennifer, I suppose the big issues from a home working point of view, actually, just as an aside, one thing we are seeing is that a lot of new employees who started during the pandemic have found the induction process, remote induction process, quite challenging for a lot of employers, because they haven't got the context of the organization, and they struggle a little bit with their mental health in trying to get to grips with the job, But one thing with regards to mental health and indeed the other health and safety risks is that you've got to have your risk assessments done and documented. And people tend to forget this, especially when it comes to mental health. We talk about the 3 levels of prevention of mental health. Step 1 is your psychosocial risk assessment. Step 2 is really the early detection, so provision of EAP, ask, don't assume, etc. Early intervention if you see problems developing. And step 3 is the whole rehabilitation piece. And you need to do all 3. My experience is that employers tend to look at the steps 2 and 3, which is the early intervention and EAP, etc. Not too bad at that, although there is an inclination to step back when it comes to mental health instead of leaning in. And we'd say lean in more quickly with mental health because you got to address the problems early. And they're better at looking at things like reasonable adjustments and accommodations and getting people back. But the psychosocial risk assessments are something that they do struggle with, but must be completed. So I think from that point of view, I think mental health is no different to any other health and safety issue, be it ergonomic or otherwise. In the home environment, you've got ergonomic issues, absolutely, and mental health issues, which is certainly a major concern. So just think of it in 3 stages, but make sure you do your step 1, the psychosocial risk assessment, because my understanding is a lot of the litigation in this area is all around the unsafe work environment, that the employee was left to work in that unsafe work environment. And without that psychosocial risk assessment, it's very, very difficult to establish your baseline. You can build all the other things on top of that if you want. You can build your resilience training, EAP, etc. on top of that, but you've got to have that baseline risk assessment done.
And something, John, that I feel really, really strongly about is the whole area of training. Because, for line managers particularly, things have shifted on their head for line managers now. And you can't simply expect that a line manager who has been managing a team in the office day in, day out can suddenly just, flip and be in a position without any support to manage a hybrid team where some team members will be in the office, some not. So I feel really strongly that, it's fine to say, we're going to offer hybrid working and it's going to help us with talent attraction and talent retention. And yes, all of that is true. But if you don't look after the people who are in your existing workforce and help them and support them around the training behind that, then it's all for nothing, because you're going to lose your existing people. So I really feel strongly that training, and it feeds into the mental health, because managers are expected to be keeping an eye on the mental health of their teams and whatever. But the manager's mental health is important too. And if they don't have the training and the resources to help them to manage that situation, then their mental health is going to suffer as well. So employers really need to think about this in the round, and there is an investment. It's not just a case of flipping your business model and saying, right, we're going to offer hybrid work. There's a policy, knock yourselves out, apply for your hybrid working arrangement, and we'll all go from there. It is a fundamentally different way of running your business, and you need to accept that. And there is a cost to that and a difference to running your business, and you need to accept that and embrace it if that's what you're going to do.
No, that's great advice, Jennifer. I think mental health is, for us, it's half of what we do at the moment in terms of the people who walk through the door. And it wasn't always that way, but COVID is going to add an extra layer to it, and we're seeing that in the worldwide literature. There is a tidal wave of mental health issues coming our way. So I think it's really important employers take that on and do the right thing. Step 1, step 2, and step 3. I think the issue with hybrid work with the trust piece is also interesting, isn't it, in terms of manager training, because they're not used to not being able to see people working in front of them. I think the tendency is to either undercompensate by saying, well, if they're working from their home, sure, they'll be grand, or to overcompensate by having meetings after meetings after meetings after meetings after meetings. And of course, neither is the correct approach, and someplace in the middle is perhaps very where you want to be. But it is, you're actually right. You're so right. It's a specific thing that needs to be covered off in training for managers. And we've a couple of minutes left, Jennifer, so I'll pose 1 or 2 questions to you. Here's a quick one. What about the Christmas party?
I think, to be honest, I think it would be a brave employer who'd go ahead with their Christmas party. Is my own opinion. I think it is, most organisations are cancelling them, finding other ways to to reward their staff and get staff together. I'm very conscious of the hospitality sector and the impact that has on the hospitality sector. A number of my clients are in the hospitality sector. They've had an awful time through all of this. But I think from an employer's perspective, the Christmas party is an extension of the workplace. And let's face it, let's be honest about it. It is difficult to enforce your social distancing and your mask wearing and all of that at a Christmas party where there's alcohol involved and all of that. So I think, and I think the reality is that as we move towards December and people are getting closer to Christmas and they're starting to think about spending time with their families and their elderly relatives, and I think there will be a reluctance on the part of employees to attend Christmas parties, to be honest. So you could end up organising the best Christmas party in the world but having nobody at it because people are too nervous. So I think as things currently stand, it doesn't seem like the right thing to do, and that there must be other ways that we can look at. I know a lot of organisations have cancelled, we've done it ourselves, the big Christmas party, but maybe are organising smaller team lunches or smaller team get-togethers.
I think that's right, and it's the year that it's the way it is, and it makes no sense to be saying, well, stay home working as much as you can, but have 40 or 50 people to then congregate in a social setting with booze and everything else involved. It just makes no sense. That the two don't go together.
No. They don't. And there are other ways of supporting our hospitality colleagues, maybe by giving people in lieu vouchers for hospitality venues, as a sort of in lieu of the cost of the Christmas party, because it's a cost to a Christmas party for every employer. But I just think it really doesn't seem like the right thing to do as things currently stand.
I think that's right. I think we just need to grin and bear it for a bit longer, I'm afraid, and get us into February, and hopefully we'll see a smoothing off of this curve.
We can do Christmas parties in March, maybe.
Well, indeed, why not? But I think you're right. Supporting the entertainment industry or the hospitality industry in another way, I think would be certainly.
I think so. Yeah, I think there's ways of thinking outside of the box a little bit on this, and I think that's possibly what we need to do. And I think people will appreciate employers taking the. I know we cancelled we announced that we weren't having a Christmas party this week, and most people that I've spoken to are relieved, because they said they would have felt a bit of pressure to go, and they would have felt conflicted, and they'd be concerned about family and all of that. So most people are relieved, and we'll find another way to say thank you.
Right. Wow, the time has moved on so quickly, Jennifer, and I'm just sort of settling into a conversation. I could talk to you for the rest of the afternoon. I know, but I did want to ask you one thing about about a staff member who refuses to work with another unvaccinated staff member. Now, of course, we know that employers aren't entitled to access vaccination records, or indeed to ask staff about vaccination, save in some very circumscribed situations in the healthcare sector. But if you've got 3 or 4 people and one person is going around saying, well, I'm not vaccinated, and the other 3 people say, well, we're not working with that person in the same room. Well, what's the best advice in that situation?
It's very tricky, John, and I see somebody else is asking, can employers introduce a vaccine bonus for employees who've been vaccinated? So asking people to self-disclose that they've been vaccinated so that they could qualify for the bonus. And the difficulty with the vaccinations, as we know, is it's not mandated, so it's not mandatory to get the vaccine. But there are also people for medical or religious reasons or other reasons who can't or won't be vaccinated, and that brings into line the employment equality legislation and discrimination on one of the 9 grounds of discrimination as set out in the employment equality legislation. So employers do have to be very careful in terms an employer owes a duty of care to everybody. Now, equally, employees also owe a duty of care to themselves for their own health and safety, but also to the health and safety of their colleagues. I suppose it's back to what Nuala said at the beginning, and what you and I have said, John, for some time, is that the vaccine isn't the silver bullet, and it's only
Yeah.
one of the weapons we have in the armory against COVID-19. So it's not the whole answer, and it would have been much more difficult for employers were it the whole answer, and were it the silver bullet. That would be much more difficult for employers in terms of dealing with people who refuse to be around unvaccinated colleagues. But again, you know, forcing the unvaccinated colleague to be the one to stay home is dangerous in terms of an employment equality, from an employment equality perspective. So again, it's about trying to find inventive ways in the workplace, using maybe the working from home solution for somebody who, again, that's the somebody who isn't comfortable coming into the workplace. Effectively, the vaccinated person isn't comfortable coming in because some of the colleagues might not be vaccinated, and that's where we have
And
to
of
try.
course, even though you're vaccinated, doesn't mean that you're totally protected. So
Precisely. But you look, I appreciate it's very easy for you and I to say that. It's very difficult when you're an employer.
They're challenging questions, aren't they? And interesting.
Absolutely.
The way the UK have gone with possible mandatory vaccination for healthcare workers. But look, Jennifer, it's been a great pleasure yet again talking to yourself and indeed Nuala about this. I'm always learning new things whenever we talk, and I'm just mindful that when we spoke, I think much earlier this year, and we both said, look, vaccinations won't be the silver bullet, as you said, and also that employers, this is not an occupational vaccination akin to hepatitis B and everything else. It's a population-based vaccination. So we've made a couple of forecasts today. Let's see where we are come March, I guess.
Before we finished, John, can we just go through the last two questions there? There's one about introducing a vaccine bonus for people who are vaccinated. What are the legal implications for that, Jennifer?
Yeah, there's different employers are finding interesting ways to deal with this issue. The biggest issue around vaccination is data protection, and it's about employers processing data and having to have a justification from a data protection perspective for processing data. And there isn't a justification for processing vaccine data because vaccine isn't mandatory, bar the exceptions that John has spoken about in certain limited healthcare scenarios. So employers are not entitled to process vaccination data, and I suppose in terms of holding on and retaining that data, that's problematic from a data protection perspective. Now, I do know that many employers are offering paid time off for people to get vaccinated, and for that, employees needed to show evidence of vaccination, so they had to come and show their vaccine cert, and where they're just showing it and the employer isn't holding on to it and isn't retaining copies of it and isn't processing the data, then we're saying to them, look, you know, in circumstances where it's paid time off to get the vaccine, because employers are entitled to encourage their employees to get vaccinated. They can't mandate it, but you are entitled to encourage it. So you are entitled to give all of the information around vaccination and make sure that employees, I suppose, are getting their information from safe and reliable sources. Because as Nuala has said, you know, there's a lot of information floating around there and it's not all reliable and it's not all accurate. So it's fine for employers, and in fact, it's the responsible thing for employers to do, to make sure that their employees are getting information from reliable sources. So nothing wrong with employers, you know, notifying employees that the preference is that where possible employees would be vaccinated, and that, you know, here is all of the information you need around the vaccinations, and, you know, and we will help by facilitating paid time off in relation to that. And I suppose, you know, is a bonus much different to paid time off? It's arguable. I mean, I suppose paid time off is I suppose slightly more objectively, it's easier to explain it from an objective perspective that people need to get time off because you can't schedule, you know, you ask employees to schedule their medical and their dental appointments outside of working hours. They can't schedule their vaccine appointment. They're given their vaccine appointment. A bonus, I suppose, is something that you're choosing to give to give to employees. If you do it, it's not entirely risk-free, but to make it as low risk as you can, what you need to do is make sure that you're not processing or retaining that data, and that all they have to show you is evidence that they've been vaccinated in order to qualify, and that you don't hold on to that data in any way.
God, it's a minefield, though, isn't it?
A minefield.
So
a minefield.
And Jennifer, this is why you are an influencer,
I've never been called an influencer before. This is great. I
There
mean,
you are.
I'm going on Instagram immediately.
We should probably wrap, I think, because we've gone to the hour. Charlotte, we can pick up any other questions that have come in and respond to people by email or whatever. Okay. But listen, thank you very much indeed.
Thank
let's
you,
call
John.
it
Thanks,
up.
Nuala.
Thank you very much to Jennifer and indeed to Nuala. That was wonderful, and we look forward to doing it again in the new year sometime. Thanks so much.
Thanks, John. Thanks, Nuala. Thanks, everyone. Have a good weekend.
Stay safe.
Bye-bye.
Stay safe. Stay at home.